Explain the term war gases, classify them, brief, describe their action. The term war gases is inappropriate as well as the substance used were not gases nor used in the time of war only. The term is meant to significantly an agent suitable for destruction or damage according to the need. Example in war to disperse unruly raw mobs. The substances may be either true gases, smoke, or vaporized liquid or fine powders. An ideal war gas must have the following qualities. It must be capable of being manufactured cheaply in enormous quantities, preferably as a byproduct of some industry. It must be definitely toxic in lower concentration as it is effective against troops distributed over a wider area. The substance must be heavier than air, so it will not be easily dispersed. It must be capable of enough volatilization to pervade the terrain which is assailed. Its chemical composition must be stable and not a type to corrode the containers in which it is stored. Substances employed are gas are classified according to their primary physiological actions. Lacrimate or tear gas, chloroacetophenone, bromohexbenzyl cyanide, ethyl iodocyanate, bromobenzyl cyanide, chloroacetophenone. Lung irritant or asphyxiant or choking gases are chlorine, phosgene, chloropyrrhizine, diphosgene. Vesicants or blister gases, mustard gas, levisite. Sternulator or nasal irritant or vomiting gases, mustard gas, levisite, diphenyl chloroazine, diphenylamine chlorazine, diphenyl cyanoarazine. Nerve or blood gas, blood poisons or paralyzant, carbon monoxide, hydrocyanic acid, hydrogen sulfide. Nerve gas, toxic chemical which action like acetylcholine. Miscellaneous yellow red rain, methyl isocyanate. Lacrimates, also known as a tear gas. The chemical in common uses are chloroacetophenone, finely powdered powder with an odor like locust flowers, bromobenzyl cyanide, a heavy oil dark brown liquid with an odor like zor fruit and ethyl iodocyanate. Also, a similar liquid with an odor like that of pear drops. They are fired in artillery shells and cause intense irritation of eyes with severe lacrimation, spasm of the eyelid, temporary blindness. The regular gas mask protects against the substances. The treatment after exposure is to irrigate the eye with normal saline and to apply sodium bicarbonate solution to air irritation which might develop in the nose or face. Lung irritant, also known as asphyxiant or choking gases. These are lethal chemicals used to kill the enemy. Chlorine and phosgene are gases, liquids under pressure, which can be released from tanks, canisters, and gas shells. Chloropyrrhizine and dysphosgene are liquids which are used in gas shells. Phosgene and dysphosgene are sometimes known as a green cross. When these substances are inhaled, they cause dyspnea, tightness of the chest, coughing, and irritation of the eyes, followed by restlessness, a rapid stertorous breathing, cyanosis, collapse, and death within a period, or to form acute pulmonary edema or a bronchopneumonia. The regulation gas mask, if put on in time, affords sufficient protection against any of the lung irritant. The treatment consists of removing the victim to fresh air and administration of oxygen, cardiac stimulant, or venesection as the symptoms indicate. Codeine may be necessary for irritating cough and antibiotics for infection. If the eyes are inflamed, they may be irrigated with a normal saline. At autopsy, there is a moderate irritation and inflammation of the conjunctiva and eyelid. There may be irritation and desquamation of the epithelium in the upper respiratory tract. There is foam in the air passages. Lungs are markedly edematous and cyanotic. Viscera are congested. There are petechial hemorrhages on the pleural and serous effusions in the pleural cavity. In addition, the most bizarre injuries due to bursting of shells may be found. Next is vesicant, also known as a blister gas. These are discharged in artillery shells so as to impregnate the area of attack. The chemical used as vesicants are mustard gases, dichloroethyl sulfide, yellow cross, epirate, and levisite, chlorovinyl dichloroarsine. Both are volatile urgent liquids. Mustard having the same smell of a garlic gas and levisate the smell of geranium. Mustard gas causes irritation of the eyes, nose, throat, and respiratory passage. To penetrate the cloth and cause intense itching, blister, and ulcer in moist areas of the skin. In rare instances, the stomach is inflamed as a result of swallowing the chemical, and this results in nausea, vomiting, gastric pain. The levisate rapidly blisters the skin and inflames the mucous membrane. After absorption, it causes hemolysis of the red cells and may produce signs of arsenic poisoning. The regulation gas mask protects the wearer from inhaling the vapor but does not protect the skin from burns unless special clothes are worn. The treatment is symptomatic: removal of contaminated clothes, washing of the body with soap and water, attention to eyes and respiratory irritation, burns, BAL. British anti-levisite is a good antidote for levisite poisoning. Next is sternovator, also known as nasal irritant or vomiting gases. These are organic compound of arsenic. They are fired in artillery shells and after explosion permeate the air and cover the landscape. The commonly used compounds are diphenyl chloroarsine and diphenylamine chloroarsine, diphenyl cyanoarsine. A person inhaling the air or swallow food or water contaminated by these chemicals suffers from intense irritation of the nose and sinuses with excessive sneezing, malaise, headache, salivation, nausea, vomiting, pain in the chest, and prostration. The regulation gas mask will protect against the sternovator. The treatment is symptomatic. Sodium bicarbonate useful as a mouthwash. Nerve and blood poison, also known as a paralysant. The substance tried have been carbon monoxide, hydrocyanic acid, and hydrogen sulfide. Carbon monoxide may be formed by the combustion of the explosive when a large shell bursts in a dowgut and causes poisoning of soldiers and trapped in such cavities. Hydrocyanic acid and hydrogen sulfide, despite their toxicity, are not suitable as war gases and have not been employed in that role to any extent. Nerve gas. These are chemicals related to phosphate esters and the toxicity. They are colorless and odorless volatile liquids. Toxic effect follow inhalation, ingestion, or absorption through skin. The chemical causes inactivation of the chlorine esterase and consequent acetylcholine poisoning similar to organophosphorus poisoning. Miscellaneous. Very little is known about this group, except that gruesome tragedies followed from yellow and red rain which struck Aberton tribesmen and methyl isocyanate which struck inhabitant near Union Carbide factory in Bhopal, India. Yellow red rain. Latoin tribesmen were struck by two gases, one colored yellow and other red. They experienced the combined effect of mustard gas, phosphine, chlorine, and nerve poison. Both the gas made their victims feel as if their body was going to blow up. Coughing yielded blood, there was burning in the throat, and swallowing was painful. These symptoms were forced by eyes turning yellow as if the victims had jaundice, the vision became blurred, and the nose tingling as if hot pepper had been inhaled. Breathing causes sharp pain. Teeth felt loose and the gums smelled rotten. Anyone whose bare skin was touched by a droplet suffered severe necrosis of the affected area and a high fever with the skin red and turning bluish black. It took about 2 weeks to die, the victims being in a severe agony throughout. Methyl isocyanate, this is a fairly stable liquid below 27 degrees Celsius. It is highly volatile and react vigorously with the moisture, alkaloid, and many common solvents. It therefore must be stored under strictly inert condition. It is used in the manufacture of pesticide, adhesives, and plastic. Even if a very small dose is ingested, inhaled, or absorbed through the skin, it usually proves fatal. In Bhopal, India, victims died within 48 hours of exposure. Complaint of severe burning in the throat, unbearable eye irritation, chest pain, and labored breathing. Death was due to pulmonary edema. Those who survived for 5 to 6 days experienced the original symptoms and neurological effects such as motor weakness, paralysis, some cases convulsions, coma, and cerebral edema leading to death. Those who survived over a week developed delayed symptoms such as shivering, dyspnea, jaundice, weakness of limbs, and died due to exhaustion. This who survived the longer suffered from fibrosing alveolitis. In pregnant women who survived the exposure, abortion, premature delivery, and stillbirth have been common. Like many other agrochemical, as long-term effect, MIC turn out to be a cancer-causing mutagenic substance. The chemical analysis of the blood reveals the presence of methyl isocyanate, cyanide, ion, and monomethylamine in the body. Treatment is symptomatic. It consists of administration of hydrocortisone against inflammation, antibiotics, tetracycline, and ampicillin against lung infection, eye drop against eye irritation, oxygen to combat respiratory failure. Sodium thiosulfate may be tried as an antidote. Thank you.